COVID-19 has changed everyday life, but it's also changed how death is handled. It's been recommended that medical examiner offices around the country, including those here in Florida, do not perform autopsies if a person dies from COVID-19.
News4 Jax reporters Kelly Wiley and Janice Harris are continuing our coverage of the pandemic. We begin with Janice Harris, who is joining us live outside the medical examiner's office. Janice, the thing that is hard for people to understand, if there are no autopsies being done by medical examiners of people who die of COVID-19, if a family member has a person who dies of this disease and no autopsy is done, how will they ever find out if maybe they died of something else?
Well, it's a very complicated situation, but I talked with the chief medical examiner today who told me that if a person dies from COVID-19 in the hospital, there is a thorough review of all of the medical records and any medical issue that that person had before their death. If it's caused by COVID-19, they will not do that internal autopsy, but they will make sure when they review those records that there was no other cause of death other than COVID-19.
COVID-19 has changed the way medical examiners determine the cause of death. If a person dies from a virus, the examiner does not perform a full autopsy. Instead, the medical records are reviewed and possibly an external review of the body. It's recommended for all examiners in the country. Local medical examiner Dr. Robert Pytak explains.
At that point, it's just external, mainly due to the fact that OSHA, or Occupational Safety and Health Administration, issued some guidelines regarding these types of deaths.
According to the Occupational Safety Health Administration, also known as OSHA, they recommend that a full examination is not performed on those individuals. If it's determined that the person died from COVID-19 at the hospital, the body will go directly to the funeral home and not to the medical examiner's office. So far this year, the medical examiner's office for District 4 has seen 16 in March, 39 in April, 31 in May, 21 in June of COVID-19 death cases. If the autopsy is necessary for death, such as a homicide, they will do the full autopsy in a separate room.
That'll get transferred into our special isolation room, where we have additional equipment such as purifying helmets, which provide air through special filters.
COVID-19 has changed the way we live, but it's also causing those on the front line to use more caution, even in death.
And so far, there's no study to show how long COVID-19 is in the body after someone dies. So if a family member says they still want an autopsy to be done, even though COVID-19 has been determined as the cause of death, it's still being recommended that that autopsy is not conducted at this time. OSHA sees this as a very high risk type of situation. So they simply don't want it to happen because it's just so unsafe and considered so dangerous. Reporting live from the Medical Examiner's Office, District 4, Janice Harris, Channel 4, the local station.